Good morning, everyone. Thank you for joining us today for the Fall Family Forum. If you have questions that are not addressed during the presentation, please email us at info@arcwestchester.org. Thank you for attending. Our presenters today will be Tibby Guzman, Executive Director and CEO, and Deborah Mondello, Senior Assistant Executive Director. Tibby will be presenting first.
Thank you, Christina. Welcome, families, to our virtual Fall Forum. Today, we will review the latest impact of the spread of COVID-19 in our area, including travel advisory issued by the New York State Department of Health and how our services may be affected. OPWD, as we all know, is continuing to plan our cuts to residential services, and we would like to share how this will affect us. And then we want to talk a little bit about advocacy initiatives that are taking place right now and how you can help. On a positive note, Deb Mondello will be updating you on our strategic plan, accomplishments, and the reopening of our day programs. And for the families who have a person with developmental disabilities living at home, we are showcasing through a short video our respite house, available to give families some relief for a few hours or to approximately a week during these difficult times. We will end today by sharing with you some safety tips for family gatherings, especially important for the incoming holiday season, to keep individuals we support safe while enjoying the gatherings with your family. We are all aware that this fall, New York and the nation is experiencing an increase in spread of COVID-19. I first want to let you know that we are doing everything possible to prevent the spread by ensuring proper infection control practices and adhering to all the safety guidelines that we received recently. And we want to ensure that staff is supplied with the proper PPE equipment. We are also providing continuous training to staff and updating the staff on the latest changes related to the prevention of the pandemic. We are now pleased to report that the last positive individual we had was back in April, and the last positive staff was back in June. So we are keeping everyone safe, and we wanted to share that with you first. Having said that, we cannot predict the future, of course. So right now I'm going to share with you the most recent restrictions related to the microclusters and travel advisory in New York area. This is important for you to know as we enter the holiday season, and you and your family member that we support may be impacted by these restrictions. As you can see here in the map, there is a visual of microclusters. These microclusters happen to be in the Queens and Brooklyn area. We're just showing it to you for effect, but to explain to you that the new rules and restrictions directly target these areas with a high transmission of COVID-19 cases, which is a high infectious rate. So the red zones, it's the cluster itself. The orange zone is the warning zone, and the yellow zone is considered a precautionary zone. The initiative will divide these clusters into these areas, and we are carefully monitoring this information and will take action if needed. These microclusters are also available in our website, so please feel free to view the maps in this section of the COVID-19 section of our website. And I think at this time, I really should explain to you that we just learned very recently, as recent as yesterday, that Portchester is in the yellow zone, and I'll explain what that means to us in our next slide. We are sharing this with you because there are several restrictions that are different in each of the zones. Again, we are only experiencing yellow zone right now in Westchester County, and that's in the area of Portchester. In a red zone, should we enter a red zone, OPWD and Department of Health have decided that residential homes, our homes, cannot receive visitors. Individuals in the homes are allowed to leave the residence, whether for appointments or family visits. So it's a little different than what we experienced when we were shelter in place. In shelter in place, we were not allowed to receive, or no one was allowed to leave the home. This is a little different. gives you our individuals a little bit more freedom to leave. However, we have to be extremely vigilant on ensuring that they are going to safe places. Now, in the orange zones, the day services are now are also have to be closed. I'm sorry, I didn't say that earlier. I believe day services are closed also in the red zones. And in the red and orange zones, day services must be closed again, in-person services. We can continue the remote services, so we will be able to shift to remote for those individuals that have been coming to in-person services in our day sites. And we have that capability, so we'll be able to transition to a remote training and program area. So the important thing here is our utmost priority is to ensure the health and safety of our community. We make sure that all infection control guidelines are followed and we all continue to live in a COVID-19 free environment. Again, this information is available at our website for more detail. I just want to reiterate that we were just advised yesterday that Port Chester is currently in the yellow zone. This is a precautionary zone. We are required to refer staff for testing and encourage individual families to be tested if you are traveling within the yellow zone. So this is important for you to know. If you are having a family gathering in Port Chester, we want to encourage you to be extra vigilant when you are contacting people who are living in Port Chester. So this is just additional advice for you, and we appreciate that you keep the individuals that we support safe and sound, and this is important for you to know to keep everyone safe. Now, in addition to the zones, we have changes in travel restrictions. This is also important, again, for you to be aware of, considering that we're entering Thanksgiving and all the December holidays that are coming up, New Year's as well. And so I think it's important that everybody understands what these new travel restrictions mean. Now, on November 4th, the travel guidelines changed. Now, there is an option. Travelers must get tested within 3 days prior to landing in New York, okay, and quarantine for at least 3 days upon arrival and get tested on the day 4 of arrival. This sounds a little confusing, but this was put in place to help travelers not have to quarantine for 14 days, because you could always opt out for 14 days. Now, if the travelers receive a negative test on day 4 of quarantine, this may allow them to exit quarantine when they receive negative results. So that means you could stop quarantine if you have a negative test result after you traveled, a second negative test result, I should say, after you traveled. So we all know that the states that are contiguous with New York continue to be exempt from quarantine protocol. And again, essential workers also continue to be exempt. Travelers who were only out of state for less than 24 hours do not need to quarantine, but must get tested on day 4 of arrival back in New York. Again, we are sharing this with you because you may be attending a Thanksgiving event where there are travelers from out of state at that event. So if they are travelers from out of state, we suggest that you discuss these mandates with them to ensure that they are COVID-19 free. It's important that we protect the people that we support, and we're asking your help to do the same. Having said all that, I think it's really important for us to continue to watch what's happening at the state. We all know that in addition to our loss of revenue due to the closure of day programs, and now due to the safe planning of opening of our day programs, because we're not opening at 100%, to ensure social distancing, we are now expecting additional losses in revenue. This is very important to share with you because families should know how our Westchester as a provider is going to experience major revenue losses. And one of the ones that are really going to impact us is the one related to the budget cuts to residential services. And I believe most of you are aware that administrative cuts handed down from New York State Department of Health, DOH, and the Office for People with Developmental Disabilities, OPWDD, could generally jeopardize the residential stability of our family members. This is very scary times that we're entering, and we need to share this terrible news with you. On May 27th, the Department of Health announced proposed cuts in reimbursement for residential programs by eliminating the occupancy adjustment resulting from vacancies. What does this mean? Okay, as you know, it takes careful planning and many regulatory hoops that we need to jump before admitting a new person to our home. And during this time, the bed may not be considered filled. The plan here is to take away this adjustment factor that paid us a small percentage while we are still maintaining the home, meaning that we have these fixed costs of staffing and of course all the expenses of maintaining a home that all of you can relate to also are a burden of ours. And so all this has to be maintained, and now we're going to have a total 100% reduction of that elimination of that occupancy adjustment factor. In addition to that, that's not enough. So the state decided to continue their slashing. And that's related to the 50% slash for retainer days when residents are in the hospital or taking the therapeutic leave day for family visits, which is also devastating. So they're putting us in a precarious situation where we built these strong relationships with families, and now we have to advise families that if you take your loved one overnight to your home, which you're entitled to and should, and it's part of the therapeutic process, that's why it's called a therapeutic day, we're only going to get 50% of our rate. And this is done supposedly to save taxpayers from paying for, I'm going to do air quotes here, empty beds, which implies services are not delivered. But you know that these are not empty beds. They are the homes that our loved ones return to. And you know that the services doesn't stop simply because they're not sleeping in the bed. So it is really important for you to be aware that these cuts are imminent. We have not heard any update since OPWD announced that CMS, the Center for Medicaid and Medicare, approved these changes effective October 1st. We are advised that these cuts will occur retroactively to October 1st. So they're still being planned, even though we have not heard lately any news on this. So it's important really for you to be aware, and then we're going to ask you to continue to take action on this. And by that, I mean advocacy support. We all know advocacy is an essential part of our culture. Advocacy is the really the foundation of who we are, the ARC, and the foundation of the services for people with developmental disabilities. If it wasn't for advocacy, we wouldn't be able to have these home-like environments, these great opportunities for diverse day programming. And we really appreciate all of you who have stepped up in the past and continue to advocate for the importance of ensuring adequate funding for our services. And also importantly, for the deserved salaries for our direct support professionals, who, as we call our heroes, and the increased residential opportunities for the vast amount of families needing the support of their loved ones. So these are some of the major issues that we'll be facing with right now. And at this point, advocacy is needed more than ever. So I want to share some of the advocacy movements that have taken place. As you can see here, with the bullhorn, we still need you to participate in advocacy. It unfortunately doesn't stop with just calling your legislators, which many of you have. And again, we appreciate that. It's important that they hear from the families directly, not from a provider. We have limitations in how we can advocate. You do not. You can talk to your legislators on a daily basis, if you like, frequently. You can challenge what they're doing. You are their constituents, so it's important that you continue to have your voice heard. And again, this is not over yet. We are part of the ARC New York, which is a statewide organization, and they created this user-friendly advocacy page that provides details on specific initiatives and easy access to contact your representative. We want you to access this page. Again, this is all available on our website. So go to the advocacy section of our website for details, or visit the arcnewyork.org/advocacy. At this point, the campaign to get these cuts removed is still in place. There are many avenues that our state providers and our state representatives are using to do that. They're doing it through a provider, a large conglomerate provider group, and they're also asking families to continue their advocacy efforts. This is part of our life, and I know many of our senior family members know this. This does not stop. We cannot rest in providing advocacy, and we appreciate what you've done so far, and we want to encourage you to continue to raise your voice and tell your story to your legislators. At this time, we want to talk about some of our programs and some of our strategic initiatives, and I'm going now to ask Deb to take over and give us a nice summary of where we are with our services. Thank you.
Good morning. Thank you, Tibby. So we're going to talk about our response to COVID-19, but also the updates to our strategic plan that we presented to you back in June, and also how we worked on our plan for reentry and what's currently happening in our day services. Next. Okay, so I think you might remember this slide from last time. This was our moving forward strategic plan. And we decided that we really needed to concentrate on 3 areas, but really 7 categories: the environment and supplies, workforce and health, and organizational technology and fiscal planning. So I just thought we could talk a little bit about some of our accomplishments over the past several months, moving into the opening of our day services. So of course, PPE equipment, the securing of it, the stockpiling, we did achieve that. We were able to ensure that all of our staff had adequate PPE equipment and build a 2-month stockpile to hold on to, of course, through this second wave in the fall and into next year. We did complete our re-entry assessment, both of the people, assessing the people that we support, and all of our physical plant spaces. So that would be about the 45 houses and the 8 sites and our headquarters. And all this was to ensure the safety of the individuals that we support and to mitigate any of the risk in terms of all of our reopening plans. As discussed in June, our workforce, the health of our workforce is really paramount to being successful in this COVID environment and beyond. So we work to increase access to telehealth for all of our staff. We also implemented quite a big project, COVID-19 tracking and tracing. So for all of our individuals and all of our staff, understanding, tracking, maintaining a master list and reporting any symptoms that staff or individuals had, and reviewing this on a daily basis and then basically a weekly basis as things have progressed. And again, tracking to ensure, as Tibby mentioned, we haven't had a positive individual since April and a positive staff since June. We've also focused highly on staff absenteeism tracking to ensure the health and wellness of our staff and to ensure that we are fully staffed in our programs. So this was early on when we redeployed our staff into from day services into residential. We were experiencing very high absenteeism rates, and we've been able to reduce that to pre-COVID-19 levels and really ensure that we have maintained a strong and healthy workforce. Technology advancements were a big focus over the last 6 to 9 months. We've been able to increase our use of remote technology, being able to provide both telehealth for our staff, telehealth for the people that we support. Providing training for our staff was tremendous. We were able to maintain our hiring practices and our onboarding and to provide virtual staff trainings throughout this time period. We also added some fiscal planning expansion because, as Tibby mentioned, due to the significant cuts that are pending and, of course, some revenue losses around COVID-19, we were working to ensure long-term sustainability. So that was a very brief sort of overview of some of our highlights and accomplishments. I just wanted to pause on this impact slide for a moment. This is a really good example of what we are currently going through or burning monthly. Just as a standard operating procedure now, we go through about 124,000 gloves and about 20,000 masks. This does not include the stockpile that we've built, and we additionally have, just so people are aware, we have gowns and we have face shields and we have thermometers, but our current standard operating procedure now is really burning through this much PPE equipment monthly, and I just wanted to share that impact. We're going to spend some time talking about the successful reopening of our day services. So day services reopened on August 17th, and we were able to provide supports in really 3 venues. We have day services in our residential programs. We have day services in person, both at our 8 sites, but also Choices is basically headquartered out of our 265 Sawmill River Road building. And we also have remote services where we serve around 50 families. So I'm going to take you through a couple of the activities that have been happening. We've been able to continue our service delivery. Okay, so in providing day services in the residences, we have about 45 plus day services staff that remain in our residential homes. And these are just some pictures of some of the activities that have been happening. We've tried to be absolutely as busy as we could be to keep people, healthy and active while still maintaining all of the Department of Health protocols and safety measures. So of course we have arts and crafts and games and bingo. We've been outside on nature walks and visiting parks. We've had soccer and exercise. Weekly cooking has been tremendous. I think our nutritionist, she's been working on a cookbook that's up to 30 or so recipes right now. We've gone apple picking. We've made apple pies from apple picking. And there's even, I think, a picture in there of the tea parties that we had at one of the residences with hats and cucumber sandwiches. So some nice news there. Okay, so in person, and this would be our site-based and our without walls or Choices day services, which I just want to mention again that Choices is really headquartered in the Virginia Donovan Learning Center at our main office building at 265 Sawmill River Road. So they are a little bit more on site than historically being out in the community, especially in light of us monitoring all the clusters. But we've maintained our in-person, socially distant group activities. We've spent some time doing some curriculums on COVID-19 education, PPE wearing, hygiene practices, but we've also had exercise and dance parties and Jeopardy and other games. There are some employment tasks on site and there's limited volunteer opportunities. And I say limited because we are really working hard to maintain all of our connections with our previous volunteer sites. But again, some of them certainly have limitations on the number of people or the number of visitors. And again, we're being very cautious about keeping people safe during this time. So those are happening in a very limited capacity. So I think I just want to mention we're very proud of our remote day services. This was an area I don't think that we had much experience in, and we dove right into it, developing different curriculums for many different activities. And we're currently serving approximately 50 families right now that are either unable to come in person or not comfortable coming in person. I've heard some really good feedback from families as well. We've done Zoom dance parties and talent shows. We also spent a lot of time writing curriculums on math and money skills and fire safety, and again, COVID-19 education. And that's a little picture. I think everybody knows what Zoom looks like at this point. Other activities have included remote drive-in movie days. We've done music therapy, we've done yoga, we've done exercise, so people could log in on their Zoom calls and participate in these groups. And also, we've focused on community safety and stranger danger. I wanted to share some remote highlights. So I thought these were exceptionally unique activities that were happening in ways that makes remote a little bit more exciting. Our day services program has made videos of individuals reading their favorite children's books to create a virtual library for the local library New York City Pajama Program. And I think that's a fantastic activity. We've done virtual excursions such as to zoos and museums and field trips. We've done virtual camp activities. We've looked at historical landmarks. We've had scavenger hunts, and we visited virtually animal sanctuaries. We've done some online games, sort of competition groups such as Spelling Bees and Jeopardy. And we've also virtually read to kindergarten and preschool children over the summer, and that was called Summer Reading Buddies to help children who are also home studying remotely. So we're very proud of our staff and their creativity, reaching out and connecting with people remotely. I thought they were fantastically creative. So I'm just going to share one graph with you. What you are looking at is our day services attendance for 2020. So at the bottom left of your screen, that's August 17th when we first opened. The bottom right of your screen has November 1st. The blue line is our in-person. So that would be the site-based, but also choices, wow, in there. The orange is our residences and the gray is our remote. So when we first opened, again, back in August, we only had about 70 people in person, and we've managed to increase that number more than double up into in the 130s, 140s there. I'm trying to see on the screen. We've also increased our enrollment in that orange line with our individuals in the residences. We have actually had several individuals who are not able to return either to programming or work or other agency programs. So we've enrolled them in our day services to support them, during this difficult transition and make sure that they have the supports that they need. So we have moved up from in the 90s to about 114 of our individuals in our residences. And you can see the gray line at the bottom are remote services. It's really averaged or around, I think in the beginning we had 60s and 70s, but those families have decided to come in to our day services program. So that's why you can see the blue line has increased. That's the in-person, and the remote has dropped off a little bit. So that number can be a little bit interchangeable. But again, we've worked hard since August to slowly, carefully, and safely increase our in-person services, monitoring safety checks, obviously health checks, and reviewing all of our data to ensure that if we have to course correct and shrink, we don't want to do that, but safety is paramount. And that's been our focus over the past couple months, is serving and supporting as many people as we can safely and with exciting activities. The respite house is a great opportunity to experience a residential setting. And I just wanted to comment that we've created several of these virtual tours for families to reduce traffic and obviously visitation or visitors, both to our residential homes, our respite house. And we wanted to reach as many families as possible and ensure that they know that we have these great services available. We've made several other videos. So for additional videos, you can please see our video library on our website to view a preschool video and a day services video as well.
Thank you, Deb. That was very informative. For those of you who have used our respite services, we know that you've had a good experience, and we encourage more families to take advantage of this great opportunity to give you some relief for your family. So as we move forward, you can see here the slide says safety tips for family gathering. And again, we have this slide up. It's very important for us to share this information with you, and this is why. You know, earlier we talked about the new travel advisory guidance from New York State as it relates to the increased spread of COVID-19. As I mentioned, Thanksgiving and the rest of the holidays that are upon us are the reason why we want to share these safe practices. We all know that large groups is an opportunity to spread COVID-19, and we want you to ensure that the people we support, whether they live in our residences or attend in our day programs, remain COVID-free. And we need your help to do that. Their health and safety is our most important priority. As you can see here, there is great opportunity to celebrate safely. And the safest way to celebrate, obviously, is virtually or with members of your own household that pose a low risk for spread. I think that it's important to say that, again, many of the individuals we support are at high risk for respiratory diseases. So it's important that we ensure that we keep all our individuals safe. So we want, again, to share these tips with you. These tips are provided by the CDC, and again, these are all posted on our website. So first of all, consider the number and the rate of the COVID-19 cases in your community. Now, if you are traveling, as we said earlier, to a red zone or orange or yellow zone, you have to be extra vigilant. Is it really make sense for you to travel there and put the individual that we support at ARC Westchester at risk? And if you are going to do that, please make sure that you follow all the guidelines that are suggested by CDC as well as the New York State Department of Health and the governor's office. Now, we all know that indoor gatherings poses more risk than outdoor gatherings. So ventilation becomes an important issue. I know I will be doing this for Thanksgiving. I am going to make sure that our windows are going to be open and that we have some ventilation regardless of the cold weather. So we're going to supply scarves for everyone while they have dinner so that we can still enjoy the gathering with our loved ones, but in a safer environment. Again, you know, the gatherings that last a long, you know, obviously 7 to 8 hours pose the most risk than shorter gatherings. So that's something to think about. If you prefer to say goodbye to your family members earlier, this is a good excuse. The other thing is that obviously more people poses more risk than gathering with fewer people. We all know that. Just on a personal note, I want to share that I'm going to have 2 Thanksgivings so that I can reduce this risk and have fewer people in each of our gatherings. As I mentioned earlier, gatherings with guests who are traveling from different places poses a higher risk, and this is just reiterating that here in this slide. So, you know, take that opportunity to question your guests or ask them, you know, are they following out-of-state, you know, guidelines and ensuring that they're safe and they're COVID-free. Again, you know, we are protecting the people that we support here, and we feel it's very important really to share this information with you. Now, masks, you know, and hand washing and all these prevention behaviors are important to ensure that we are keeping everyone safe. So if we have gatherings that we're not adhering to social distancing and not wearing a mask and not doing hand washing and other preventive behaviors, you know that the risk is higher for your loved one to get COVID. So please think about these things and think about social distancing and hand washing frequent hand washing and wearing masks to ensure that we have followed all the preventive measures that are being implemented. Again, there's more information in CDC guidelines, and we have them all listed in our website for you to help us to make sure that everyone that we support is kept in a safe and healthy environment. This actually ends our presentation. I hope you find it useful. I think it's very important for us to make sure that we continue to communicate with you on a regular basis. And I want to thank you for your attendance today. And please feel free to email us here at info@arcwestchester.org for any questions. We want to make sure that you have a happy and healthy and safe, and be well and be safe to all you and your family members. And we are happy to have our spring family forum. And I want to thank you again for joining us. So I bid you farewell at this time, and take care, everyone. Be safe and be well.